Do you have a rectocele, also known as a vaginal prolapse of your rectum, and you don't want surgery? Have you considered a pessary? Maybe you've never heard of a pessary, or maybe you've tried one and you'd like to know how to make it work better for you. I'm the Kegel Queen. I'm a registered nurse, and my name is Alice Adams. In this video, we'll talk about how a pessary can help you care for rectocele without surgery. First of all, what is a pessary? I have a few samples to show you. A pessary basically is a silicone device that sits in the top of your vagina and helps hold your organs in place. This is way up at the top by your cervix, around the same place where a contraceptive diaphragm would go. And I have a couple samples of pessaries that are used specifically for rectocele and other things, but this one not so much, but this is just to give you the idea of a pessary. This is a ring with support. These two are pessary shapes that are more often used for rectocele. This one's called a Gellhorn, and it's got this little sticking out part here. This one is called a cube for obvious reasons. And there are many, many other shapes and other shapes that I don't happen to have samples of to show you that are used for rectocele, but basically it's a little silicone thing that you wear inside your vagina. And advantages of a pessary is, for one thing, it's safe. There are some risks with pessaries, like you can have, they can be irritating to the vaginal tissue. There are ways to minimize the risk of that, but mostly they're really, really safe. And if you develop an issue with a pessary, they are reversible, completely reversible. You just take it out. But as long as you care for a pessary properly and you have your healthcare team working with you to care for a pessary properly, they are very safe and, again, reversible, which is very different from surgery, which is forever. The big advantage, too, of a pessary is when it's fitted properly and it's working well, you experience relief right away. So it's not, sometimes if it's fitted properly and working well, believe it or not, even something like this with this sticking out thing, you think, oh my gosh, what would that be like to have that inside my vagina? But really, if it's fitted properly and it's working well, you can feel complete relief right away. And you're not going to feel a lot of sensation. You're not going to feel like this thing is poking at you. You might notice that it's there approximately the same way you might notice a tampon is in place. It's not a huge big deal. So in order to work properly, a pessary needs a couple of things. For one, you need the right type. We've just talked a little bit about some different types. And even for two women, let's say two different women have the same diagnosis of rectocele. One might do great with this one, the Gellhorn, and another one might do great with the cube. But there's no, you have to have the right type for you. It's a very individual process. And then the pessary needs to be fitted correctly. They come in a range of sizes, and you need to try a bunch of different ones. It's not uncommon to need to try many, many different pessaries before you find the one that really fits properly for you. Then the other thing is that a pessary needs, in order to function well, it needs to be held in place by your pelvic floor muscles. Those are these muscles here. Here's your pelvis, right? And inside we have these muscles, the pelvic floor. We could talk a lot more about those. Keep it brief just to show you the pelvic floor is this bowl of muscle here. If that bowl of muscle is not toned enough and it doesn't have enough mass, it can limit your ability to hold a pessary in place properly and limit the ability of the pessary to work well and be comfortable. So that's where Kegel exercises come in handy. Kegel exercises can really help by building the pelvic floor tone, building mass of the pelvic floor, and it's not unusual for women in my program to have a pessary that wasn't really working so great, and then they do Kegel exercises correctly, which most women are not doing, by the way. Once they're doing Kegels correctly over a period of time, then the pessary works so much better. So to find out more, please go to kegelqueen.com. I'm the Kegel Queen, and I'm here to help.